5. That's half of the ICU. I thought I mentioned earlier that gives us 7 beds,
Seven.
seven
Okay.
ICU beds
For COVID and for COVID only.
for COVID.
For COVID.
For
Okay.
COVID only, yeah. We partitioned, we separated that whole area. Half of it is for non-COVID. The other half, which is 7, we're using 7 for COVID.
When you say partition, what do you mean? Are you talking about like a curtain or what?
A sheer plastic curtain to again prevent the transmission across, but at the same time for some visibility. So yeah, it's just separating and making sure that those who are not COVID ICU, they're on a separate. There's a separation.
So
There's
they're
a
not sharing
partition.
the same air.
They're not right.
Right.
Exactly.
And the four in the emergency room, are they in
Mhm.
isolation? I thought there were only two isolation rooms in the ER.
There are 2 isolation rooms with the capacity for negative air pressure. And so, but we have there are isolated. The others are protected. So we maintain isolation for those individuals with a COVID positive.
Lillian,
We put in measures.
I just wanted to go back to the tragic loss of one of your own. And what's the mood like when you guys lose a nurse, but in the middle of this war, no matter what, the next day you got to get back up and come into work again. So just in talking with your staff
Yes.
and doing the rounds this morning, what are they saying?
I haven't had a chance to go and do rounds this morning, but right after yesterday's situation, the doctors who were working with the staff and the nurse who passed away, they did a debriefing right then and there, and so allowing the staff, because they were all shaken,
Right.
and so allowing the staff and recognizing that they're going through some emotions
Right.
that need to be supported, and so the doctors were very good in doing that for the staff.
I wanted to read this because this is going around. It's a graphic of Marnette Agabao, and there's a little screen cap of a WhatsApp message to my ORPACU family. Thank you so much for the beautiful orchids. You made me cry knowing that with the short time that I worked with you, I felt welcomed and appreciated. Thank you for your prayers. I'm slowly recovering and hope to be on my feet again soon to work. God bless, keep safe, and keep up the good work. So I think it's
Okay.
just even harder to read that and knowing that she was at a point where she thought she was going to recover and go back to work and get right back into this battle.
Hmm. Right. That was, yes. We thought that she was making some progress. She was even looking to retire. So it's sad. It really is.
I mean, I would.
And all the more reason that we have to fight. We have to continue this fight and prevent others from dying and prevent others from getting really really sick. And so, as much as the governor and everybody else, the surgeon cell, the physician advisory group, and all of us. Professionals and nurses, and we've been telling the community to really heed the warnings to prevent the infection. But unfortunately, people are human beings, and so they want to continue doing what they want to do as far as their activities and what brings them satisfaction. But at the same time, they really need to take this, and I've been saying it, take this very seriously. It's a concern. Be responsive, be responsible. We don't want to see any more death, and so help us with that. And if you're starting to feel, and I don't think that we can really stop the spread of infection, because people are going to get it. But the secondary prevention is, if you start feeling the symptoms, get tested, see your doctor. And don't wait for 7 or 10 days that you've been having the fever, you've been having the abdominal pains, the headaches. Go and get attention right away, medical attention, so that you can be treated as early as possible and not get to the point where you're seriously ill. And so, again, please, let's all take heed of this brutal virus. It's a brutal virus. And so, it sneaks up on you. And just when you think that you're not going to get it, you just keep that mask on, keep the distance as much as possible. And so let's try and let's just, as so what Daphne said, we are stronger when we're united and not against each other, not fighting against each other. But we have to come together and fight this battle.
Thank you, Lillian. God bless you, and keep us posted. We'll be praying for you and your staff.
Thank you. Prayers are very powerful and very helpful.
Take care, Lillian.
God bless
You
you.
too.
Wash your hands.
Take care.
Okay, Esther.
Yes.
9:20, we'll take a short break. And it's been a minute since we checked in with the Guam Fire Department. Obviously, they're doing a lot of things with the COVID-19 response, so we'll do that next. 9:20, the link on the Breeze, 93.9. Good morning.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Hafa Adai. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
And he's picking my heart.
All right, thanks. Hey, thanks for jumping on our stream. I accidentally tripped over the Wi-Fi plug for a minute.
It's your fault.
Go ahead.
I said it's your fault.
Yeah, it is. It's all my fault. Always, every day, all the time. 9:24. Thank you guys for watching. It's the link on the Breeze 93.9. Lillian Posadas again. Every time she comes on, imploring, begging, asking us to follow the lockdown orders to keep not just ourselves safe, but our whole island. 9:24. Let's go back to the KUAM News Zoom room where you have the chief of the Fire Suppression Bureau, Chief Ed Chaco, and the spokesperson for the Guam Fire Department, Kevin Riley. Good morning.
Did we get that right?
I hope so. Probably not. Did I? Go ahead.
Right now, Chris, we have Chief Chaco. Chief Chaco is the Northern Commander. He is also serving as infection control specialist and the field safety officer for this COVID response.
So we were way off, in other words.
Did we promote him?
Hey, you're promoted, Chief. I mean, no, fire suppression kind of sounds like the place to be at, where it's like, okay, fire suppression, nothing COVID.
Infection control specialist. Right? That's what,
right. Yeah, so you're the guys with the hazmat.
Is that right?
So I own all our COVID responses, so all the protective wear, the eyewear, anything that deals with that.
Right, and I guess we'll just start there. Chief, if you could describe what GFD's role is in the COVID-19 response.
Everything.
Yeah, everything, I know. But
Yeah, so obviously GFD's role is always going to be to safely and effectively manage patients regardless of what's going on. My duty as an infection control officer and a field safety officer is one as the infection control officer. My job, my primary duty is to ensure that our guys that are boots on the ground get the most current information when dealing with policies, practices, and procedures relative to COVID. And as a field safety officer, my primary duty there is to ensure the health, safety, and welfare of all our personnel.
I gotta ask, with the rising number of cases, I could only, I guess, assume that would mean a rising number of transports, right?
Absolutely.
Right. So how is this, I guess, how are you guys managing with that?
So,
Because I remember when we talked to Chief Stone, he was mentioning how every time you guys transfer somebody, then you have to like decontaminate the medic, and there's a downtime for that. And then there was also I want to say like a COVID transport unit that was established at Estumbo. Is that still the case, or have you guys had to open more like COVID units?
So we still currently have 2 COVID units, and they have been instrumental in handling the rise in our COVID cases. We've additionally stood up a decon team, which I'm sure you're aware of. And so that decon team helps expedite our medics to get back in service. Our decon team's primary role is to is when the ambulances go to their destination, they disinfect the ambulance, they clean the ambulance, and they put it back into service. The other personnel on that decon team, they facilitate the doffing or the removal of the PPEs so that our guys can remain safe and return to duty in an expeditious manner. So just so you understand our numbers, to date, we've handled over 1,300 PUIs, surveillance cases, and COVID positive cases. Our 2 COVID units responded, accounted for 467 of those responses, which amounts to around 35% of the response. So, as you can see, the vast majority of our responses is still being performed by our engine companies and non-COVID designated medics. But 35% is the optimum number, given the fact that, for COVID, the response, the goal was one, to reduce exposure to our personnel, Number 2, to minimize contamination to the ambulances. Number 3, to free up our ambulances for our normal day-to-day operations. So we feel that reducing exposure 35% of the time for our personnel is a good number. We feel that 35% of minimizing contamination in the ambulance is a good number. And but the biggest impact of the COVID unit has been the transfer of confirmed COVID positive patients.
Chief,
Guam Fire Department has moved over 152 COVID positive patients, and the COVID units accounted for 105 of those transports, or 70% of those transports, leaving our ambulances to deal with their day-to-day operation.
What about testing of firefighters? Have we maybe just run down status? How many positives have we had from GFD, and where are we, if anywhere, with testing the rank and file in the department?
Yes, so currently we tested 82 firefighters based on exposure. So exposure is defined as being in the proximity of a contamination without the proper PPE or any part thereof. So whenever there's a gap, or whenever there's when something goes wrong with maybe not wearing the appropriate PPEs or wearing your PPEs late, then we do an exposure report. And so when it's deemed that these firefighters have a medium to high risk, then we test them. So we tested a total of 82 firefighters and dispatchers referenced to relative to work exposures, and we have 0 infections. The only positive we had was the dispatcher with household contact of family member.
And this is the one over the weekend, right, Kevin?
Right.
Right. Where are we with the dispatch and E911? Are they reopened? Is everybody back, or are they still in Agana?
No, definitely. What happened was because of our exposure with a family member at home, the dispatcher was exposed from family contact. We took the necessary precautions. When she tested, she had been tested positive. We made sure that our dispatchers were removed from the thing. We set up our alternate site, which is something that we do all the time when it comes to typhoons, when it comes to issues with the building or any incidents. We can switch over. We had the lines transferred, so there's no disruption in service. The calls keep coming in for 911. The dispatching keeps happening for all our emergencies. And then, as I said, Chief Chaco sent up the decontamination team. We made sure we thoroughly cleaned it using approved CDC chemicals to clean all the work surfaces, walls, the entire workspace, to include the Guam Police Department, who also shares the room with us. So when they're doing the decon, we had them transfer to our HQ, set up shop here, transfer over with no disruption. When that was complete, they were free to go back to their workspace, transferred it back, and we were fine.
Okay. And I'm sorry.
So currently, yes, we are back at the 911 center.
Mm-hmm. Okay.
What about status of overtime? What's the deal with the overtime? I mean, is there an issue? How far back are we in paying the rank and file at the department?
Who are you talking to?
Whoever can answer.
I'm sorry, I'll what was the question again?
Kev, where are we with the status of overtime paid to the firefighters in the department? Are we behind? Are we current?
He didn't hear the question.
Are we overtime?
Yeah.
So we are just our personnel are coming in as far as RDO cancels because of lack of manpower. We're not experiencing a significant increase because we have not had any positive cases out in the field. So we're maintaining status quo as far as that's concerned.
You know, when you talk about not getting any positives out in the field, do you think that's a kind of testament to the protective measures that the Guam Fire Department is, mandating its firefighters use?
It's definitely 100%. Like Chief Chaco was saying, as the infection control specialist, he's making sure he goes on virtually every COVID positive run, make sure that the donning and doffing is correct at the PPE, make sure that everybody's wearing their PPE. At the stations, we have the sanitizing stations outside the doorways. We have the hand sanitizer. Personnel are wearing masks while on duty. So yes, absolutely, we are doing our best to make sure that we do not contribute to the spread and keep our personnel safe. Throughout this COVID, since the start of this COVID response, we have had to make sure that our personnel are healthy. These guys are, essential to continuing this operation well into the future. We need to sustain them.
Mm-hmm. And I guess, Chief Choco, if you could just take us through what a day is like for you when you are out there on the front lines responding to these reports, these calls.
Okay, first of all, I think the firefighters deserve recognition because it was their early buy-in. It was their understanding the gravity of the situation. That is really the reason why we're infection-free regarding exposure. So these guys, the firefighters, we are heavily engaged, as you can see with our numbers, and our firefighters continue to be poised to fight. And I want to acknowledge our firefighters because it's them, it's their actions that keep us safe. But let me just run you through, let's say a normal call, right? So a call goes into dispatch, and so we develop what is called public service answering points or the 911 questionnaire. So in addition to the chief complaint, the dispatchers ask questions to try to ascertain if it is a PUI or surveillance case. If it is deemed a PUI, then the units are alerted and they're told to elevate their PPEs, get into the proper equipment. Our medics, when they receive the information, they're taught to have a standardized, methodical approach to these PUIs. So they slow things down and they get their mind right, and then they get into the proper PPEs. When they get into the proper PPEs, when they arrive at the scene, the first thing they try to do is they try to see if the patient can be brought outside. Fresh air, fresh air, fresh air. That's the motto for our firefighters, right? So if they're brought outside, we maintain a 6 feet distance and we try to make our assessment. And if we have to break that 6 feet bubble, we break it for whatever time is required, and then we move back. We smartly place masks on patients. We have them turn away as we're making our assessments. We approach from the back as we're putting on the mask. And when let's say they have to enter the house now. They enter the house. They're looking at stuff, things like the air conditioning unit. Where is it blowing to? The fans. Any additional personnel or people that may be in the house. But then once we mitigate it by either turning off the AC units, removing people from the house, then we treat any immediate threats to life. And once we treat those life-threatening injury or illnesses, we move them out of the house and we make our assessment outside the house. So it's the attention to detail that these guys has been a reason for success. Right. So we transport our patients to the hospital, and then we have our decon team waiting for them there. The decon team has 2 people assigned to it. One person's primary role is to ensure that they clean, disinfect the ambulance, and make the unit ready for service. And the other person's responsibility is to ensure that there's proper removal of the PPEs and that it's exposed in an appropriate manner. And so by doing this, we bring our units back to service a lot quicker than our past practices.
Mm-hmm. Chief, how do you, because what we've seen as we wind into like 7-8 months under these conditions, collectively, the community lets the guard down. So how do you kind of instill in your guys, obviously it's training, it's the protocols and stuff, but you ever have those moments where you got to be like, hey guys, no, we got to keep on because you're right, we're getting 0s and 1s and all that stuff, and I think people kind of let their guard down. So how do you kind of communicate that to your guys?
I think it's the constant updates, and I believe that I believe that while at work we have such a heightened level of awareness. We make sure we keep our distancing, and I caution our guys that when we're off duty is when we're probably going to be the most susceptible. And so, although we can't dictate and we can't direct them, to do certain off-duty activities. We just remind them that, hey, if it's a high-risk event, or if it's there's more than an X amount of people in the house and they're not in the same household, then refrain from doing things like that. But I want to say that our first positive for any of our firefighters is likely going to be from a household contact and not in relations to our normal duties at work.
Right, you say that, but have you ever, and maybe even you, Kevin, have you gotten it from maybe your children or your spouses who've said, Daddy, please, I'm scared for you, don't go to work or anything like that? And how do you deal with that? And I ask this because, we just saw a frontliner, a nurse at the Guam Memorial Hospital pass away. And I just want people to realize that every day that you guys go to work, every day that a police officer goes to work, that you're putting your lives at risk and your family's lives at risk.
We trust the process. We trust in our PPs. We constantly train so that there are no gaps in what we do. The best way we can protect ourselves is through our personal protective equipment, to social distancing, to hand hygiene, and we just have to trust our equipment. And based on our current numbers, it works. We've also implemented policies in place to protect our family. We have this, we relaxed our uniform policy so that firefighters report in civilian attire when they come into work, and they secure and shower in civilian attire before they go home, so as not to track this infectious virus home. So we have measures in place to protect our firefighters, and honestly, as we started seeing, because we're starting to see household contact. We have 4 firefighters who are quarantined because of household contact with family members who have tested positive, and now it's hit home because it's a family member. So now we have that extra caution, we have that heightened sense where we make sure that we distance ourselves at work as well, and we make sure that we follow the prescribed practices and protocols.
Tev?
Yeah, Sabria, I know where you're getting at. Every day, like you said, whether it's COVID or just regular work, our guys put their lives on the line every day. It sounds so cliche, but it's very true. And when pandemics or certain circumstances come up like that, it really shows. But it also shows our training of our guys. It shows our commitment to the department. It shows our commitment to the island. It shows that they're willing to take on, I'm not going to say extra risk. They're willing to take on extra responsibility to stay safe. They're risking to, they're taking risks, but also adding on the responsibility of keeping their family safe and keeping them safe. We all have, families here. Our guys continue to show up to work, not because they have to, not because, they're mandated to, but because they want to. And with their proper PPE selection, with their training, they know that they're going to go home safe, or at least that's, the expectation. All right. And of course, I know the family members understand that when they took on this job, right, certain aspects of this job are dangerous, inherently dangerous. Whether we have COVID or not, these guys every day are, I would like to say we're not adding risk to it. We're adding more responsibility.
Okay, have you guys had to rescue any more knucklehead military hikers during this lockdown or what?
We always encourage people to enjoy Guam. I said it a million times. We encourage you to get out there, see Guam, see how beautiful it is. Everybody talks about Facebook's how beautiful our island is and how wonderful it is to go hiking. The weather is great, but be safe. That's what we're asking.
How do you get lost at Mount Lam Lam, guys? I mean, damn, there's a freaking trail, dude. Hell. And these guys come here like, we've hiked Mount Everest. I've scaled the Himalayan peaks.
A perfect point. I don't know who the group is that went out there and placed the signs and the new ribbons, but the Guam Fire Department, in conjunction with the United States Coast Guard, the command center there, because we deal with them on a regular basis when it comes to search and rescue, even if it's land or sea. So we actually went down to Pauget Caves and observed the markings, and the markings are very nice. Whoever that group is that did it, kudos to you. There's signs pointing to the cave. There's signs that point to the cliffside, the coast, along the route. There's new surveyor's tape on the trees, making it very difficult to get lost. However, there is that chance, especially in the evening
However,
time.
they still find a way.
We're human. So
Yeah, because they're American, and they think
It's the beer.
the beer.
All right, Chief Chaco.
No, let's keep talking about the military hikers.
Yeah, you
Were
want
they-
to.
were they hashers
We're
or
gonna
what?
have Manoni on tomorrow, the
All
Ever
right.
Admiral.
Okay.
So, Chief Chaco, any final message you'd like to give out to the community?
I guess just everything that's being pushed out. We know that when you look at the numbers, right, and the ratio, I know that there's a lot of factors that play into it, right. But when we had 42 out of 1,000, and then you have 80 out of 800, when you break that down into ratio, that would mean that 1 in 10 people that you encounter are positive. So I know there's variables like contact tracing and home quarantine. But really, I think to stop the spread is we need to do our part as a community. We need to hold this virus at bay by not having a host available to them. Our firefighters, they're poised, but we've been at this for several months, and so I've tasked the supervisors to look at their emotional wellness and the physical wellness of our firefighters, because we've never been through this before. And I really just want to foot stomp and thank our firefighters for their continued diligence and their vigilance in what they do to keep the community safe. And we'll be here throughout this pandemic.
Kev?
Yeah, so I got a couple shout outs I would like to do also. As Chief Chaco stated, at the onset of this, we initiated 2 COVID units. In order to put these additional units at the station, we had to upgrade our decon area at those stations to specifically for these gentlemen and women of our fire department that were conducting these transports. With the assistance, of course, of Homeland Security, BSP, the administration, and Red Horse Squadron, who's still actually doing construction work to make sure that our guys have the proper areas and decon areas. Chief Chaco has been out there day in and day out, just making sure that our guys are safe. Chief Stone has been, leading us in a great direction. And, of course, I would like to especially, express my thanks to our firefighters out on the field. Those guys are top notch. They know what they're doing. They're the best at what they do. And as Chief Chaco mentioned, we need to support them and make sure we support them in the long run also.
All right, thanks
guys.
Kevin, Chief Chaco. Be safe out there.
Absolutely.
All right.
Take care. Stay safe, Bob.
Right on. Wash your hands. 9:47. We'll take a short break, and we'll come back and close out the show with a look at news here on the link. It's The Breeze, 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
Hafa and Mabuhay, I'm Ann Pobutsky. I'm the Territorial Epidemiologist for Guam. Wearing a face covering protects you and those around you. We know that COVID-19 can be spread by people who are not showing symptoms, which means they are asymptomatic. Because Guam remains at risk for significant community spread or transmission of the virus, it is a necessary precaution to wear a face covering when you are in public. Everyone must wear a face covering when they leave home, have it visible at all times, and put it on when they see others nearby. Face coverings are required for everyone when shopping at stores, seeking healthcare, and inside the workplace. Covering your face reduces the chance that you will unknowingly infect someone else if you are carrying COVID-19 but have no symptoms. Prevention saves lives. For more information, please call 311 or visit our website at dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Hafaday and Mabuhay, I'm Ann Pobutsky. I'm the territorial epidemiologist for Guam. Wearing a face covering protects you and those around you. We know that COVID-19 can be spread by people who are not showing symptoms, which means they are asymptomatic. Because Guam remains at risk for significant community spread or transmission of the virus, it is a necessary precaution to wear a face covering when you are in public. Everyone must wear a face covering when they leave home, have it visible at all times, and put it on when they see others nearby. Face coverings are required for everyone when shopping at stores, seeking healthcare, and inside the workplace. Covering your face reduces the chance that you will unknowingly infect someone else if you are carrying COVID-19 but have no symptoms. Prevention saves lives. For more information, please call 311 or visit our website at dphss.guam.gov.
If I go, would you come running? Save this lonely soul today.
Hey, good morning. The Link on the Breeze 93.9. A friendly reminder, guys, in compliance with the government of Guam's executive order, all First Hawaiian Bank branches closed. Today will reopen tomorrow at noon. ATM, night deposit, and online and mobile banking services are still available for your banking needs. 9:57. Let's go ahead and close out the show, Sabrina, with a look at news here. Sabrina Salas-Mantanani, good morning.
Hafaday, good morning, everyone. If you were listening to our show earlier, Guam will remain under PCOR 1 lockdown or stay-at-home order for one more week. Adelup Press Secretary Crystal Paco San Augustine announcing right here on the link that Governor Lulian Guerrero will be signing an executive order today to extend her declaration of a state of public health emergency for Guam until September 30th. The executive order will also extend her PCOR 1 stay-home order for one more week or Friday, September 4th. Paco San Augustine says there will be changes to the stay-home order, though. Effective tomorrow, residents will be allowed to go to public parks and beaches for exercise, but only for individual use. As well, banks and the Guam Treasury will also reopen tomorrow. Parking lot masses will also be allowed. She adds that all social gatherings they will be prohibited. Doesn't matter what size, no social gatherings. The governor is expected to hold a press conference today, so we will of course, carry that on our social media platforms, and you'll be able to watch and listen to it for yourself to get all the specific details. Also, this just in, the Guam legislature has the authority to cancel the primary election. That is the opinion. It was just issued. We just got a copy of it by Attorney General Levin Camacho in response to a request that was made by Senator Kelly Marsh Taitano. The legislature, they are meeting in an emergency session today to act on Speaker Tina Muñoz Barnes' bill to cancel the primary balloting. AG Camacho, in his opinion, says the legislature has the authority to decide what to do with the more than 2,000 ballots that were already cast. He also said there does not appear to be a violation of federal statute for canceling a primary. Again, we just got the opinion from the Attorney General of Guam, Levin Camacho, that the legislature has the authority to cancel the primary election. Senators are scheduled to go into an emergency session at 11 o'clock today. Guam's COVID case count has risen to 1,120 confirmed cases out of 952 samples ran through various local labs on Wednesday. 136 returned positive. There are more than 676 active cases right now, and 435 people are in recovery. 9 people on Guam have died from the coronavirus, 2 of which just passed away yesterday within 5 minutes of each other, and one of them was a registered nurse working for the Guam Memorial Hospital. 4 more GDOE employees testing positive for COVID. The latest cases were identified at JFK Ukadu High, and 2 were identified at GDOE's headquarters in Tidzin. This brings the total number of GDOE employees that have been infected with the virus to 17. A 4th employee from the Port Authority of Guam has tested positive for COVID. General Manager Roy Respicio says he received the results of the 30 employees tested as a result of contact tracing for the 3rd positive port employee, and all came back negative. However, they received notification from an employee who was not connected to any of the prior cases that had tested positive. Respicio says they identified the employees who had been in contact with the latest case, and testing was done. The Guam legislature confirms 2 more employees had tested positive for COVID. According to a media release, both are on home isolation. The last day they were inside the Guam Congress building was on Wednesday, August 12th, the day before the facility was closed as a result of its first positive case. Currently, there are now 5 positive cases at the Guam legislature. And that is your news.
Thank you, Sabrina. Thank you, Joe, sir. Thank you, Jason. There's a press conference today.
Yes, that's what Crystal said, because the governor is signing that executive order today to extend the stay-at-home order for 1 week, and also to extend the declaration of a state of public health emergency for 1 month.
Right on. 10:01. So, keep it on the KUAM social media networks and catch that press conference. Remember, we got your 6 with our primetime newscast at 6. So for Joe Sir, Jason Solis, Master Control, Kengineer, of course, our stable of awesome KUAM News reporters. Good job today, Sabrina.
Good job, Chris.
Guys, be safe. Let's do our part. Wash your hands. Wear your mask. Stay home. Por favor. 10:02. I'll leave you guys with this one. Heaven Can Wait. Daryl Anoni, one of my favorite tracks from Live Local Fridays. Again, Sabrina, good job.
Thank you.
And we'll see you guys. We got your 6. Say this is the link on the Breeze 93.9. Guahusi Chris. Está. Adios. God bless you, Guam.